Welcome to P Passionate W World, R Radio N Network, LLC, a multimedia company. Ann Arbor, Michigan, Boston, Massachusetts, Liverpool, England, Melrose, Florida, Los Angeles, California, Fullerton, California, Washington, D.C., Chicago, Illinois are one of the many broadcast homes of PWRN, a multimedia company. The world in your hands. And now, without further ado, let me present to you one of our many hosts and their programs.
Welcome to the Energy Stoners Cafe. My name is Toni Quest, and I'm really happy that you're here. I like to interview the most interesting people I can find on the planet. So grab a cup of coffee, sit down, relax, and listen. You're going to find that these guests are so intriguing, you'll wonder why you didn't know about them before. The following interview was recorded on March 12th, 2020. Hi, welcome to the Energy Stoners Cafe, and you're back again. I'm back again, and I'm really happy that you listen to my show every week. It's just a joy and a privilege and an honor to have you as listeners. And I am also honored to have the best guests on the planet. I actually do whatever I can to find the most interesting people to present to you. Tonight, we have a wonderful guest, and I think having him on is kind of pertinent and timely. His name is Dr. Robert Clark. He is a practicing family physician in the CSRA. You just told me, Bob. Tell me again.
It's Central Savannah River area, which encompasses parts of Georgia and also South Carolina, North Augusta and Aiken, South Carolina.
Okay, so you're really kind of like from where I sit, it's like you're really part of America here. And so we do try to find people that are from out of our area because there are a lot of reasons for that. But I'd like to get a good perspective with this show, Energy Stoners Cafe, because it's a big, big, wide world. There's a big, wide world that listens to us. So Dr. Clark is chairman of the board of the Center for Primary Care. And I want to ask him about this, is that there's like a trend that started, I'd say, if we're in 2020, it started easily 15 or more years ago. And I think it started down where you are first. That's the first time I actually saw that there was a corporation that actually handled medicine. And I don't even think there are many hospitals where you are from what I remember. And that's something that actually made its way up to the New York area and in Westchester County, as a matter of fact, where we're broadcasting from. We have a big, huge corporation, at least one. There are actually a couple of them that actually run primary care. And it's something, I guess, relative to when I first met you. It's relatively new here. Explain to the audience why that is somewhat more efficient, I imagine, than just going and finding a doctor and showing up at his office.
Our practice is physician-owned. I've been at the practice now since '95. So we're a physician-owned practice that we have over 43 primary care providers, mostly physicians. We've kind of grown our practice and I've really maintained a physician leadership and physician-owned. Now, there has been a trend of hospital-owned physician practices, and then you'll have corporations, as you've mentioned, who own practices. And here recently, you'll have a lot of, especially in primary care, you'll have a lot of urgent cares and prompt cares that will be either partially owned by doctors or partially owned by hospitals, and then you'll have these corporations. So everyone is trying to gather patients to help feed whatever system they wish. The practices that are private owned, they're just dedicated to primary care. Hospitals are trying to make these multi-conglomerate systems to help their overall system. And it's kind of ever evolving in healthcare. delivery, and it's very confusing and it gets complicated at times.
What would you say are the advantages? I can imagine what the advantages are for a physician. I've always been told by other physicians that I know that the most daunting expense that they have is insurance. So it becomes more of a collective. I think that's what it's about up here, but I'm not going to say for sure because I don't know for sure. It's just what I'm kind of surmising.
Well, the advantages for the physicians is multi-factor. One is that you get to share expenses. So the expenses of employees, expenses of equipment, buying supplies, and having availability to negotiate with insurance companies and provide services. So it's very helpful to be in a bigger organization, whether it's a big private practice group or being employed by a hospital. When you're employed, you don't have to think about a lot of those things, which some physicians prefer just to be employed.
Okay. All right. I can imagine that. I can imagine that would be an advantage. Now, what is the advantage to the patient aside from just having all your records in one place?
I think you want to, as a patient, you want to be involved with a system that is concerned about you. I think nowadays there's a lot of incentive for patient sharing record information between organizations. There's a big push from the federal government to do that. That has continued. And so I think the most important part for a patient is that you have connectivity towards your physician. And to be able to have someone that you can rely on for information. And that's the most important because it can get very confusing. And I would encourage everyone to get a primary care, especially as time progresses. You can go to 5, 10 different doctors and things get kind of confused if you don't have someone anchoring and really understanding who you are.
Right, as a patient. I'll share with you that not too long ago, a friend of mine had a mini stroke in the early morning hours. She called me. I was about to call an ambulance, but she insisted I bring her to the hospital myself. So it's amazing how fast you can run and drive in an emergency, and I don't want to have to ever do that again. But what I was impressed with is when she was in the emergency room, the technology kind of took over where they needed a specialist to speak to her, and they had a screen, and all of a sudden there that doctor was on the screen, and they're talking to each other. She's in the bed, he's on the screen, and I think it's kind of amazing. I happen to love technology. I wouldn't say it was like a soft and fuzzy kind of thing, but it was interesting that he was right there and he had all these records in front of him because he was miles away, many miles away. She was in Westchester County, and he was in New York City, as I recall, but he was actually able to engage and she was able to speak to him. What do you think about the technology, how it's changed? I know you have an opinion, but I just want to share with the audience from your point of view.
Yeah. Well, the telemedicine is going to transform and will continue to transform healthcare, especially with patients who don't have access to a highly qualified specialist, especially in rural areas or particular areas. You will find that telemedicine is helpful. Across the country right now, we have a severe shortage of psychiatrists. And so we will have a lot of telemedicine throughout the country going on with psychiatry. And it will continue to progress. It's more efficient that way. But when you get a complicated patient with multiple things going on, it makes it tough. At sometimes you just have to be there with the patient and look at them in the eye and touch them. It works better. So I love the phone and I love video. It's great. But some patients, you just got to be there. It doesn't work. It just doesn't work.
I imagine that's very important with children and very old people. All of us in the middle, we're in the middle, but the other ones,
Well, I think when you're in the exam room and you have a husband there who's telling you the story, and then you have the eye roll from the wife, that really kind of lets you know what really is going on. So those little subtleties that go on in the exam room is just as important as if someone was just looking on the screen. You can't really see who else is really there in the rooms, and the body motion and all that. Because when we communicate, we're people who actually have to look at a person. And so it's harder when you're on the television screen as opposed to when you're there. Better than on the phone. obviously better than text messaging, which has its own problems. But getting information from a patient is the most important aspect of healthcare. So whatever the best tool to use is face-to-face. If you have to choose something else, then I like video.
What about surgeries? Like I understand that surgeries are often done very remotely.
Yeah, you can use robots and those kind of things. Again, if you don't have that specialist there who's highly technical in a rural area, that's awesome. Robots and using the old standard way, the outcomes are about the same. So it's really about who hand is driving the surgery.
Right, right. And how is it being like the head of, this organization with, you said 43 different doctors? I mean, do you have like a handle on what's actually going on in the community? And it sort of makes me segue into our current problem internationally with this coronavirus. Now, how does that play into what you do, and what have you observed, and how does your organization help contribute to healthcare when we're having a pandemic?
We had the first serious thing with the coronavirus. SARS was a while ago. And so we kind of follow the CDC guidelines, and they give us updates whenever time they have an epidemic. So we get a lot of updates and reports from Lancet and other articles that come out and actively feed us, and the organizations give us advice and those kind of things. This most recent coronavirus or COVID-19, it's been a little bit more confusing with the current administration. They've made it kind of tough on us.
Yeah.
But we get some great information now from the CDC, and we kind of follow their guidelines. And that's where we're at right now. From an organizational standpoint, our issues are our employees. We're concerned about them. So we have to put in protocols, making sure how we clean places. If a patient calls, what we need to do, everyone has their own number, what number to call for them, and just setting up multiple different protocols if someone gets sick and those kind of things.
Are you getting a lot of calls about this? I mean, what's going on where you are with regard to this COVID-19? Is it COVID-19, right?
Right, that's correct. Oh, well, everyone's in a sheer panic, and that is not good. Yeah, I'm not sure how it is in your area, but they're cleaning out stores and have lots of rumors and doing some not so good things. People are trying to buy a whole bunch of masks running around, and which is not a good thing. They're spraying themselves with disinfectant.
What?
Yeah, it gets kind of when people get into panic and they don't understand how these things work. So you really have to take a deep breath and kind of step back and kind of relax a little bit. It's a serious disease, and I'll say the same thing that everyone else has said that you've heard. And hand washing is the thing. You have to hand wash and to protect yourself. That is the number one thing to protect yourself. It's more efficient than actually using the hand sanitizer.
A hand sanitizer is only because you don't have access to soap and water.
That's correct. And so you don't want to use a lot of hand sanitizers, right? Because if you're using a lot of hand sanitizers, you dry out your hands, right?
Yeah.
And then they crack, right? And then your hands and a good intact skin with moisture is your first layer of defense in your immune system. It's your first layer of protection. And so if you keep, using a whole bunch of hand sanitizers, you're going to actually lower your immune system in effect. Yeah. So if you think about it like that, you say, oh, I don't want to do that. And so it's better to use soap. If you don't have access to water, then use the hand sanitizer. But it's better to use soap and water, just plain soap and water. And you don't need antibacterial soap. No, just regular old soap.
Yeah, regular bar soap.
Soap is fine.
Yeah, it works like a charm because soap is not antibiotic, but it's also like it does the same thing the hand sanitizer does, but probably more efficiently, I imagine.
Yeah, it does. It kills
antibacterial.
Antibacterial. It kills the COVID-19 without any problems, and so it does its job. So And I would again say to people, don't wear masks unless only people should wear masks is people who are sick.
Okay, don't wear it if you're well. You don't need to wear one.
No, absolutely not. And actually, what will happen is, there's a reason why you don't do that. Is that when you wear a mask and you're not used to wearing a mask, what always happens is you start making adjustments to your mask. You're touching your face, right? You end up touching. You gotta and so that's the thing you're not supposed to do. And so to wear a lot, right? It doesn't make any sense. And most people aren't wearing it correctly, and you only wear it when you are treating an infected patient or the patient is sick.
Right.
They wear it.
Okay.
And so it's when you do those kind of things, a lot of times patients actually inadvertently cause themselves more harm than good.
Well, I got to ask you another question, and I was talking to our director about this. He was looking at a map, and he noticed that the coronavirus was barely touched Africa.
Yes, sure. It makes sense.
Why does it make sense?
Okay, because the coronavirus started in China, right?
Right, uh-huh.
Okay. So if you look at flight patterns, the most flights out of China go to Italy.
Oh, see, I didn't know that.
And so it's very important to understand how humans, Homo sapiens, travel, right?
Mm-hmm.
And so that depends, and that happens on diseases.
Yeah.
And so, and that's why diseases are popping up where they're popping up. It's basically on how humans travel. And so if we go back, and for your listeners, if they want to remember the Ebola scare, remember the Ebola?
Yes, I remember that.
Okay. And so everyone, if you're around, remember, people were really terrified of Ebola. Well, one of the things that should have been comfort to you is that where that country where Ebola came from, there was no direct flights to the United States. So there's no one that could get to the United States. Okay. So they had to go through Paris. And then they had to go to Germany. So if you remember when the Ebola came out, they had maybe one case in Paris because that's where the flights were, right? And they had one in Germany, and that was the end. And so they really contained it because that's how the flights were. That's how people travel. So you can always, in epidemiology, you have to follow the traveling aspect of the disease.
Right, the traveling aspect.
Yeah, and so speaking of that, part of when you're having these kind of infections, there's also a cultural aspect of the disease. And so when you look at Ebola, since I mentioned Ebola, in that part of the world, when a person died in that part of the world, their culture was that every one of the family members gives a wonderful funeral, and everyone gives them a hug as they pass them across to the next life. Well, problem with that is that Ebola still survived after the person passed away.
Oh, really? So it lived as even though the organism is dead, the Ebola is still alive.
That's right. And so what happened is that it took the World Health Organization a lot of retraining of culture to have that stopped, and then the virus it went away. But you had to retrain the culture. Okay, so here we are with COVID-19, and so we're in the United States, and so we have a culture too. We have a culture of people who are mildly sick still go to work, right? Hey, you don't get much time off of work. Hey, I don't care. You need to show up to work, and it doesn't matter. I got to work. I got to do my thing. Well, the problem is that when you take that with COVID and it stays around for 14 days, you can cause more infections. And so part of the issue that you hear going on is that they're trying to retrain employers and people to really understand that, hey, if you're sick, you need to stay home. And so that's part of this cultural aspect of retraining the population to try to cope with this kind of virus.
Yeah, I mean, I think we're a very working society as compared to, let's say, a European society like Italy, France. I'm not saying that they're lazy, but we have a culture of working for whatever reason, and for whatever reason that is, that's what it is.
That's exactly right. Mm-hmm.
I'm seeing a trend, and this is even before this particular coronavirus outbreak. There's been a trend in this country for people to work at home, do businesses from home. It was something that was predicted, I'd say, at least several decades in the last century, that people would be working in their own businesses at home. Even if they have a job, they have another business at home. I'm finding that they try to put their work, their business as close to home as possible, and very often it's just in another room in the house.
Sure, absolutely, and it's more than likely that this infection will help push more businesses to do that. That they were already progressing towards that. Yeah, absolutely will.
Right, and so could that be a factor to help to slow this virus down? Because it seems like every time I turn on the TV, it's somewhere else, and it's a little worse.
Part of the issue, when you mean by worse, as far as across the world, it's already got outside. China did the world a great favor in that it gave the world a month to prepare, and so you have to understand that. When we found out about this novel virus or new virus, you only found out about from people who were really, really sick already. That means is that you only knew about cases that were really, really sick people. And so the people who most people get better, more than 95% get better. So you kind of missed those other people. You didn't know about it. What you're seeing is that. So the cases that you're seeing now are people who had the disease, 2 weeks ago.
Oh, and then sort of recovered from it?
Or no, they got infected then.
And they got infected then.
Yeah, 2 weeks ago. So you'll see a spike, and then you'll see a leveling off, and then you should see it kind of figure out which way it's going to go from there. We'll know a lot more about it in probably about 2.5, 3 weeks from now.
So how do you protect yourself? I mean, you're around patients all day, every day. How does a doctor protect him or herself from contracting a disease? And also, the second part of that question is, the flu is more prevalent, I imagine. Just the flu, which sounds so common, and there are vaccines for that. Like, how is this all playing together? Like, I often wonder, how does the doctor stay well? I saw my doctor sick once. I was like horrified.
Sure.
I think he had a cold, and I was just like horrified.
Yeah, that's right. That's right. So, I mean, first of all, we're human beings, right? So we get sick just like everyone else.
Uh-huh.
And so we understand that some preventative things that you have to do. So I wash my hands about 40, 50 times a day.
Wow.
Okay. So
your hands are like dry as the Sahara.
So I'm washing with soap and water. I'm not using a hand sanitizer. So you have to wash your hands. So I wash my hands before I go in the room. I'm washing my hands after I go in the room. I'm washing my hands the next patient I go in the room before I go in. I'm washing it after. I mean, so I'm constantly washing my hands. So the hands are your number one transfer that you're going to get diseases from.
So no handshaking. Don't be shaking hands.
Prior to this, I used to shake every patient's hand.
What do you do now? Fist pump?
I do a fist bump and an elbow bump. That's what I do
elbow
now.
bump. Oh, I like that.
I do that. Well, and there's a reason why you can. Those are okay. Is because when you're shaking someone's hand, you have your palm is open, and so when you have an open palm, that's where your viruses are or bacterium is. And so when you touch your face, you're going to use your open hand to touch your face or your eyes. That's normal. I mean, we do that as human beings, but you don't use your elbow to touch your face, right?
No, that's right. I don't usually do that.
No, you really don't. Right?
Although I know a martial arts move with an elbow that I got taught once, but that's about it.
Yeah, exactly right.
Won't be using my elbow for that. But the other thing, it's like I'm concerned is I remember once being in as if I was only in a doctor's office once, but I remember that the equipment that was around, I know the table that you put the sheet of paper goes down. I was an eye exam, and there's this thing you put your chin on. And I remember this was years ago. I guess I'm a little bit of a germaphobe. I'm not like a crazy person that way, but I didn't want to put my chin on that. And I said to him, doctor, I don't want to put my chin on this. Look, who else was on this thing? But who else put their head and their forehead in this? And he went and got alcohol, and he swabbed it down. He said I was the first patient to complain about that. He called it a complaint.
That's right. Well, I know in our offices, after each patient, we remove the paper. They spray down the table. Then we have a solution that we spray down, and we wipe down the counter. And so that's what we normally do. And so I can't really say what other practices the other doctors do, but I know that's what's going on in our office. So.
Okay, that's a good thing, I imagine. So when you come home after work and stuff, what do you change clothes in the garage before you walk in your house?
I think my wife wants me to wear a hazmat suit when I come in the house, but no, I just change my clothes not because I'm worried about infection getting on me. I'm tired and I want to change into comfortable clothes. But again, like I said, I'm washing my hands all the time. And I wash my hands before I leave the house. Leave work. So I'm rare to get sick. Rare, very, very rare.
Don't say it, knock on wood real quick.
That's right. It happens. But
it happens.
If you can do, it happens. As long as you're doing all the preventative things, then you're doing the best that you can.
So tell me, what is the difference between this virus that's going on around now and the flu? You're speaking to someone right now, and I hesitate to say it, but I'm going to say it, as I've never had a flu shot in my whole life.
Shame on you.
I know. That's what I'm told. And I kind of tend to stay a little bit below the radar and out of crowds. I always have.
Well, I'm going to say this about the flu, and it's easy to try to do a comparison between COVID-19 and the flu. They are a lot different, but they do have some similarities. Do you know? I'll ask you a few questions as you're interviewing me. So, do you know how many people have died this year from the flu?
Thousands, I imagine.
43,000.
Wow, that's a lot of people.
In the United States alone.
What? I'm thinking they had to be from a foreign country, not here.
No, that is only in the United States alone.
Really? Old people, though? Older people?
No, actually, this year is one of the worst years for kids this year.
Oh, no.
Only over 300 kids have died this year from the flu in the United States alone.
Wow, that's a lot. Well, I'm going to get a flu shot because you said to get it.
It's very important. We had the epidemic of flu in 2016. You remember that year?
I had flu that year.
And so in 2016, 95,000 people died in the United States alone from the flu.
Oh, my God.
Yeah.
That's a lot.
And so just to put it in perspective for you, there are about 41,000 to 43,000 deaths from car accidents per year in the United States.
Okay, that's a lot too.
Flu's more.
Wow, that's something to think. My thing is they talk about things like compromised immune system, autoimmune diseases, people like with rheumatoid arthritis, multiple sclerosis or whatever, someone that hasn't had a flu shot in their life that has an autoimmune disease. You don't really know how that flu shot's going to react in that body.
That is true. You never know. But what you have to always, like everything in healthcare, there's always risks and benefits of anything. If I draw blood, I'm always weighing the risk of me causing a problem or not causing a problem. So the risks are far smaller than you getting flu. So that's why we recommend giving the flu shot.
So people with autoimmune disease probably need the flu shot more than everybody else?
Yeah.
Okay.
Yeah, they do.
For that reason. Okay.
Just for that reason. So now when you compare COVID-19, that is more of an older person's disease that we find out so far. It's ever evolving, but it generally has the worst symptoms in people who are older. So that's a big difference between flu and COVID-19. The other big difference is that COVID-19 has a R naught that's higher.
What's an R naught?
It's a term that we use that says, what is my risk of contagion? An R naught is like for every one person, how many people can I infect if every one person has a disease? Okay?
Yeah.
Makes sense? So the R naught for flu is like 1.2. Mm-hmm. R naught for COVID is 2.5. It's double. Let's put it in perspective. Measles has an R naught of 16. Yeah, that's really high. It's contagious. but we don't know any more than that, and because it's new. And so the latest data is that, and I just read this email about 10 hours ago, so that's pretty new. There's no flu. You can run around and infect people right before you have symptoms. Okay, so there's an asymptomatic phase to it. Mm-hmm. Well, it appears, and this is only right now, that COVID really doesn't have an asymptomatic part to it.
But just tell the audience, I know what asymptomatic means, but just explain to them what asymptomatic, because the average person doesn't understand that language.
Well, what it means is that you're not having any symptoms. So as long as you're not having any symptoms being fever, cough, and shortness of breath. Okay, those are the big ones. Mm-hmm. The other ones are muscle aches and like a low-grade fever. If you're not having any of those, then you're not infecting anyone. You're not transmitting it. So you're not walking around giving it off and, I'm okay. That's what it appears like. Whereas a flu, 3 days before you have symptoms, you are infecting people.
That's great. Oh.
That's the difference between the two. And that's just over the last 10 hours. So there'll be more information that comes out, but that's what the latest study I just saw had said.
So I guess as we wind this interview down, I'm going to have you back on, but as we wind it down, I think the best thing that this chick here should do is walk in and get a flu shot. That's the first thing I should do, and keep washing my hands.
Yes, keep washing your hands. Dawn will be running around with a mask on unless you're sick, and
keep your environment clean.
Keep your environment clean, and if you're sick, stay home and do your fist bumps and elbow
bumps and fist pumps. That's it. No handshaking, everybody. That's it. And sneeze into your elbow. I always sneeze into my elbow. I learned that a long time ago.
Absolutely. Yeah. And when you wash your hands, sing happy birthday to yourself 2 times.
I do that. I always sing happy birthday to myself, Bob. It's just what I do. It doesn't matter when it is. That's right. I know. Congratulations, I say to myself every morning. Anyway, because I woke up again. But thank you, Bob. This is a great interview, and I thank you for coming on. I just remind the audience we were talking to Dr. Robert Clark, and he knows his stuff. I have to say, I thank everybody for coming to listen. Thank you so much, Bob. I appreciate it. You've been you've offered a plethora of information. Okay.
Oh, thank you.
From a regular, real live doctor, and I appreciate it a lot. And I thank the audience for coming to listen to the Energy Stoners Cafe. I'll be back the next time with someone else that's super interesting. And stay safe, be healthy. Don't sneeze into your hand and shake it with anybody. Don't do anything. Wash your hands. Wash your hands, everybody. And when I come back on next time, I will have had my first flu shot. There you go.
Well, that'll be wonderful. There you go.
Yeah. There you go.
Yay.
Thank you. Yay. Okay, thanks, everybody. Stay healthy. Bye. Thank you for listening to the Energy Stoners Cafe.
Thank you for listening to Passionate World Radio Network, a multimedia company. You can listen to this program all over again at PassionateWorldRadioNetwork.com, Facebook.com/PWRN, Twitter.com/PWRN, GooglePlus.com/PWRN. Distinguish yourself from the ordinary. And remember, please keep listening.